the secretory phase. Now this is the point you have to keep in your minds. Did you get that? Okay. Which phase is fairly stable phase and which phases are very flexible and changing variable phases? Okay? Yeah. Well, that's a good question, okay, because if it becomes moderately irregular, okay, in a woman, then there are chances that the secretory phase can also vary, but in every cycle it will not try to vary, okay. If the cycles are changing, there will be a very little change in the secretory phase and there will be a very big change coming in the, it will happen like this, okay.
Doctor,
Yeah.
do you mean the post-syndrome phase?
Yeah, this one.
Try to constant?
Yes, yeah. In the same female, if the phase is coming for 14 days, it will takriban remain 14, 14, 14, even if the cycle, total cycle is changing, okay. If from the beginning in one woman it is 13 days, for example, maybe in some women it is 13, it will try to remain 13, 13, 13 plus minus like this, okay. It will not change much really, okay. The change is actually coming in the first two phases. I think it's clear now? Great, okay. So this is very important. So if you want to calculate the point of ovulation, will you calculate it from the forward cycle or from the backward cycle? What do you think? In a woman, if I ask you to predict the cycle, will you go from calculation of the secretory phase or will you go from the calculation of the, yeah, because you are not sure about actually the first two phases, how long do you take. If the last 2-3 cycles were having 14 days of the secretory cycle, and now you see I give you a length of the cycle that now it is 35 days, you will first consider the 14 days from here, from the back side, and then you leave it. Okay, this is the point of ovulation. This remaining part now is your pre-ovulatory time, okay, and this is the point of ovulation. You got the message? Yes?
What about the proliferative phase?
About the? Well, proliferative phase really depends on how much time you are giving to menstrual phase. If this is short, then proliferative is long. If this is becoming long, then the proliferative phase is short. There is quite a variable. Even in the cycles, usually the females have, yeah, same, usually does not change much, okay. 4 days, 5 days, 5 days, 5 days, 5 days, it goes on like this. Sometimes it can become 4 days, sometimes it can become 6 days, but usually remain, okay. If it is changing, then it is affecting the proliferative phase. It depends really, isn't it? Okay. So you got the message of the cycle and you got the phases. Anything else which is confusing you here in the cycle, which you are not getting? Any question which is coming in mind? Free to ask. Yeah.
How can the woman know if she ready for fertilization?
For fertilization.
Because the ovulation will occur after the menstrual.
Okay. For that, she should have some idea about the ovulation time, isn't it? If a woman has an idea about the ovulation and the couple knows, both male and female knows, husband and wife knows, and if they want to conceive, they want a baby actually, and if they have, yeah, the intercourse around the dates, okay, close to the dates of the ovulation, then there are more chances, imkan of fertilization increases very high. So that is, I'm coming to this point. First of all, idea about the ovulation or the indicators of the ovulation, okay, that is another important thing. Go to the topmost area where you have the ovulation in the graph, and then you come down to the second level of the graph. What is given in the second level of the graph? In the second one, okay, from top to second, okay, temperature. We have not discussed temperature as yet, right? Okay. Now, look at this temperature. What is happening to the temperature? Where is the change in temperature coming? Layer. This is the most important thing. Now you know the change in temperature. A woman knows that she's going normal, she's having a normal temperature, and one day she feels or experiences that she's normal, she has no disease, no infection, nothing, okay, and there is a slight rise in the temperature, body temperature, 1 degree, okay, it changes. That is probably the day when ovulation has occurred, okay? So otherwise she does not feel anything which is coming out. She does not hear about any explosion which is happening. Obviously, no sound is coming. Usually no pain is there, no feeling is there, no discomfort. Usually it is not there. Sometimes there is some pain or discomfort happening or bleeding happening inside. Yeah?
Doctor, the fertilization can last or can happen in the secretory phase only, right?
Fertilization, no, sure. There is a difference between fertilization and conception and the implantation, okay? Secretory phase is waiting for the implantation of the fertilized ovum. Implantation happens 5 to 6 days after fertilization. You know, fertilization occurs and usually there may be a time of 4, 5 days or 6 days for the implantation, okay? So if fertilization has occurred around the ovulation time, you still have a time of the secretory phase majood, okay? And in that, slowly the fertilized ovum moves and it is dividing and the cells are developing, blastocyst is developing, and that gets implanted. The zygote will get implanted into that. So it is coming takriban 1 week after fertilization or 5 to 6 days after fertilization. During this time, here you will have somewhere normally implantation in most of the cases, okay? It's not, fertilization means sperm is entered and fused with the ovum, okay? Now that can happen. When can that happen? That is another interesting time, okay? We'll talk about the fertile period or the window, which is the best time when a couple should know, okay, which is the period, fertile period, or the fertile window. And if the couple does not want children, they must know that this is the time, dangerous time. If they have sexual intercourse, then there are very high chances of the baby or the conception, isn't it? Okay, so it means if they know the period, husband and wife, they know it, they will have intercourse or sexual activity before that time, or they will have after this time, but they will try to avoid really during that time. And if they want the baby really, they will work maximally daily, okay, during that period of time for about 1 week or so, and that will give a very high chance. So this knowledge is very important, okay? This is called the rhythm contraception. We'll talk about that later, okay? But that's another application which is coming in, okay? So please, because for that you need something else. You need few things like how much is the life of the sperm in the genital tract, how much is the life of the ovum, okay, and when is the sexual intercourse happening. Then you calculate it, that is it possible to have fertilization before ovulation, after ovulation, or at the time of ovulation. We'll talk about that more inshallah, okay? But did you get the idea? So basal body temperature, the temperature of the body. Oh yes, about 1 degree change in the temperature from 36 to 37, and the day it changes. It's a very simple test. You don't have to go to the hospital. The woman should not be a very learned woman or a doctor or a nurse or trained in this, okay? Simply have a thermometer, okay? Buy it from Sedalia, okay, one thermometer, and just tell the woman that if you want to know about your ovulation time, do one thing, okay? Sleep normally, wake up, and before rising from the bed, daily, on the daily basis, start your temperature from the day 1 of the cycle. You know the day 1 of the cycle, yani? Bleeding starts, okay? You start with temperature daily. When you wake up in the morning, put it under your pillow. You take it out before getting out of the bed, put it in 2 minutes and see the temperature. Khalas. You know. Next day, do the same thing. Next day, temperature is very slightly changing, okay? One day will come, somewhere in the middle, maybe 13 day, 14 day, 15 day, 16 day, whatever the day is, there's definitely a different. Yesterday it was not like that. It was like, yeah, 36 or 36 point something. Now it is 37 point something, and I am all right. I don't feel anything bad. Why is this temperature? That is the day probably ovulation has just occurred, and that is the time if she wants, fertility is very high. If she wants to conceive, that is the best time for trying for conception. Yes, okay, and yeah. So in this way the woman knows about approximately about the ovulation time. There are some tests, other tests also, but this is how we do it. Is that clear? Okay. Now Any other question, Shabab? Yeah, dear. Yeah, Abdurrahman.
The female had a history of unilateral ovariectomy.
Bilateral or unilateral?
Unilateral.
Okay.
Does that influence the
Fertility?
fertility and the cycle?
Yeah. Yeah. You know, the probability of fertility goes to 50% because you have removed, simply in mathematical calculation. But still, alhamdulillah, it's by the will of Allah. Even she can have normal fertilization and conception, baby.
The menstrual, the cycle.
The duration. Now, will it really affect that is another good question really, that how will it affect the menstrual cycle, yani uterine cycle, because the amount of the hormone which is coming, okay? Well, it may be affected to some extent, but it is not necessary that it will cause a significant change, because even from one ovary there will be a growth of 6, 7, 8, 9, 10 follicles at the same time, because the FSH amount which is coming, that is okay, pituitary is all right. It is working on one ovary and there are kathir, hundreds of thousands of ova still maujood in one ovary, okay? And it is working on those, they will start growing and a good amount of estrogen and other hormones will be produced. So apparently there will be no difference, but still, okay, the chance of fertility is reduced, okay, still it is reduced, okay. There could be sometimes problems in some of the females when there is unilateral ovariectomy, because if other ovary is not working very well, which is the only ovary left now, then there could be a slowing down of the process of fertilization, okay. About the? Okay, menopause. In case of unilateral ovariectomy, will there be an early menopause? I have not read any article that really shows that it is a definite correlation that all those cases who have ovariectomy, unilateral, they will have an early menopause. Still, I think it is not a significant difference, but I'll have to check for your question, okay. That's a very nice question. I personally haven't studied that relationship, that what happens in the articles, okay. I'll get back inshallah next week when I come, I'll answer your question for that. But so far I have not read that, okay. All right. Now, there are some changes in the cervix and in the vagina, okay, because these are also the part of genital tract. When the hormones are changing, when the hormones estrogen phase and the progesterone phase, there are changes coming. When there is an estrogenic phase, okay, it means there are more chances of fertility, because estrogenic phase is at its maximum just before the ovulation, so it's a very good time. In the progesteronic phase, okay, when you are away from the ovulation, 4 days, 5 days, 6 days away from the ovulation, you are in the secretory phase now, okay. Uterus is very good, but now think about the chances of fertilization, and it will be less. Why? Because when progesterone is there, the secretions become heavy and thick, okay. There is a thick mucus which is secreted, very rich and thick mucus. Now, if a couple has an intercourse and there is a very thick mucus maujood in the cervix and in the vagina area, okay, will the sperms easily pass through that very thick mucus? Okay, well, let's suppose there is a water here, okay, and I have to walk through a water, okay. I will walk with some difficulty, but I can cross, or I can swim through the water, okay. I'm swimming, basically sperms are swimming, so they swim in the water. When the mucus is very thin in the estrogenic phase, or just before ovulation, or just after ovulation, it's okay. The mucus is very thin. Sperms can easily pass through that mucus, cervical mucus, okay. But instead of like water, if I put asal here and I put the sperms and I ask sperms to pass and swim through that asal, will they be able to pass easily? It's very, very difficult, okay. Sticky and very much resistance is there, so they can hardly pass through, and the chances of reaching there where the ovum is waiting is very low, okay. So it means, yeah, fertilization becomes less in which phase? Fertilization, I'm saying. Okay. And fertilization is best around estrogenic phase, end of the estrogenic phase, taqriban, just a day before ovulation. Okay. Yeah. Or at the time of ovulation, that is the best time where you have it. If you have kathir amount of progesterone, it will become difficult. Things will get difficult and difficult. Okay. So cervical mucus, there is a test also. If you want to check what is the phase right now going in the female can take out cervical mucus. Okay. By passing the finger inside, she can take a cervical mucus, and if she just, it's like a sticky, like asal. Okay. So if you have a drop of asal in your hand and you try to do it like this, okay, if it's very thick asal, if it's very thick and pure, real asal, okay, what will happen? You cannot elongate and make a thread like this, okay, it will break, okay. And if, yeah, it is very thin, mixed with other things also, you can make a long thread like this. So if you have a mucus and the mucus is thin, what will happen? You will form a thread or you will not form a thread? Thread formation. Thread formation shows the mucus is thin. Mucus is thin means which phase is there? Great, okay. If you have a mucus and you put it here, oh, it's not forming the thread, it's breaking quickly, very thick, attaching here and here, but not forming the thread. It means which phase is there? Okay, so it's a very simple testing. Okay, on the slide also there is a special test really, it's a Fern test. Okay, I'll show you that test also, the diagram of the test. The pattern, okay, I'll talk inshallah and show you the fertility patterns also, estrogenic phase and the progesteronic phase. But these are the simple tests for the ovulation, okay, by which we can come to know about it, all right. In the vagina there is also changes coming, okay. Follicular phase, cells are a little different, okay. When you are in the luteal phase, there is lot of removal of the cells or the desquamation which is happening, okay. Likewise, there are some changes in the cycle also related to the fallopian tubes, okay. Estrogens try to increase the activity of these smooth muscles, all right. So they will bring the rhythmic movements of the tube. In the estrogenic phase, the tube has the movement, more movement, okay. And the secretions are less. In the progesteronic phase, what will happen to the secretions of the lining? Increase secretion. And what will happen to the movement? It is progesterone now. Progesterone is the inhibitor of the smooth muscle. Estrogen is trying to stimulate the smooth muscle. Okay? So different activities will be seen in the fallopian tubes also. When will you have more movement of the fallopian tube? In pre-ovulation phase or the post-ovulation phase? Yeah, movement, more movement, estrogenic phase. And when will you have more secretions in that phase? Khalas, that's it, okay. This is done, this is done. And the summary is that we have done the ovarian cycle and we have done the menstrual cycle. We talked about the different phases and we compared the ovarian cycle with the menstrual cycle, and we tried to match the phases that ovulation is dividing ovarian cycle into how many phases and this uterine cycle into how many phases, okay. We compared the effects of progesterone, thermogenic effect also, which is the indicator of the ovulation, okay. So in this way, this graph is the most important graph. If you don't read anything and if you just discuss and sit the graph, different parts of the graph, and you write all the sawal which is coming in your mind and get the answers of the questions, your job is done, okay. Everything is given in the graph actually, but you need to analyze every part of the graph, what is happening, okay. The rest is written in the slides, you can read it yourself. Any other question? Yes, dear.
In the fertilization,
Mm-hmm.
the implantation of the fertilized egg,
Yeah.
during the secretory phase, is it occur normal or?
Implantation.
During the secretory phase,
Yeah.
maybe it's the 9th or 8th
Day, yeah, sure. Exactly. After 1 week, normal. It is normal. Because it takes time. Fertilization happens in the fallopian tube. Okay? Baid. Then you have to move slowly. The ball, this Qurratul Qadam is moving very slowly every day. And it is reaching after many days into the uterus. okay, and then it gets implanted into the uterus, but before it has to travel a long way. It takes time, okay. So there is a difference between fertilization and implantation time, okay. There is a gap of some days, 5 to 6 days at least between that. After that it happens usually, okay. You got the idea? Thank you very much for staying. Thank you for your patience. We are done.